Hello, my friends out there in TV land. Today's Tuesday, November 13th, 2018. I'm Fran Duvall, your host for today. And today we're going to start off the show with Dr. Dar, our medical director here at Green Spring Village. Welcome, doctor.
Good morning.
I sort of know what some of the things you're going to talk about.
Today I think this is a flu season.
Mm-hmm.
And unfortunately, we already had a little bit of, heat recently associated with flu, stomach flu mostly.
I see.
Over Green Spring, we saw some patients with nausea, vomiting, diarrhea, and we thought that probably it's because of the stomach flu. And this is the special season. It starts usually in November and ends up in April. So this is something which is not unusual, which is absolutely normal. The good part is that we are on top of it, and probably the whatever number of patients we saw is slowing down. Actually, I think we are in control.
Oh, that's great
Yes.
news. That's very good news.
Yes. Basically, there are two types of flus. I will talk about. One is the stomach flu, and the other one is what we call influenza. This is the season of both viruses. Stomach flu is mostly associated with the abdomen. It causes inflammation of the bowels, and as a result of that, you can have nausea, vomiting, abdominal pain, and diarrhea. And whenever nowadays, it's self-limiting. Most of the time it gets better on its own, but because it is more severe in children's and old age people, and old age people have a lot of other issues. They cannot go stand up and walk and drink fluid. Sometimes they get very dehydrated, and that causes trouble. So that's why in our community it's very important to be aware of these symptoms. If you have nausea, vomiting, abdominal pain, or diarrhea, don't assume anything that you will get better. Just call the medical center for advice.
Okay.
And we are available during the work hours, and after the work hours, if you develop any symptoms, call the security, and security knows and they have instructions of what to do. What usually happens is they call us, the on-call doctor, and the on-call doctor then talk to the patient and over the phone try to evaluate what is in need at this time. If needed, then we have special packages available for patients with norovirus or stomach flu, and we ask the security to provide this to the patient. We do not encourage patients who have these symptoms because of norovirus to come to the medical center because of risk of spreading to other patients. The best thing to do is that stay home. Once your symptoms are completely resolved, at least 24 hours after that, you can go out. The community have made provisions also that in case you have these symptoms, try to stay in your apartment. Do not allow anybody to come and visit you. You can tell them that your help is appreciated, but I cannot take a risk to spread it to the other person.
Sure.
So you can come after once everything is settled down. And you can also ask the food personnel to provide food at your apartment. And do not wash dishes of other persons, and do not allow any other person to come and wash your dishes.
Okay.
And the incubation period is 12 to 48 hours. It means that if you are exposed to a person who had this disease, there is a chance that in 12 to 48 hours you will develop those symptoms. The disease itself lasts for 1 to 2 days, and once the symptoms are free after 24 hours, you are free to go out and talk and compensate whatever loss you had. But during that time, please take care and keep yourself very hydrated. The virus itself, it's a one virus, but it has different varieties, at least minimum 33 varieties We call it genotype. And so if you have a virus during this season, there is no guarantee that you are not going to have another,
another type
another
or
attack of virus, because this different type can attack you.
uh-huh.
Once you have a virus, usually you can develop immunity, but the immunity is short term. It lasts about 6 months to 9 years. So the same virus can affect you and the different virus can affect you. So this is true that you can have multiple time
Okay.
of viruses in stomach flu during the same
Now,
season.
doctor, the stomach virus type thing that you're describing, that's not what we got a flu inoculation about, right? The flu shots
No.
don't do anything for that.
No,
okay,
not at all.
that's what I
Not
wanted.
at all.
Okay.
So I'm coming to that.
Yeah,
Yeah.
I just wondered if we could get a flu shot for that kind of, but we can't.
If you have a flu shot, and I know that most of the person who are staying here got the flu shot, that flu shot is going to cover you only flu associated with nasal congestion, shortness of breath, sneezing, fever, body ache, tiredness, fatigue, what we call influenza. This vaccination or flu shot is not going to help you with stomach flu.
Okay, okay.
So stomach flu, I talked about, most of the time if you are sick, all you need is keep yourself at home, keep well hydrated. If you have nausea, vomiting, the package you get from the security has the medicine called Fran that you can take, and it is going to help you to ease down your nausea and vomiting. And for diarrhea, we have added some Imodium in the packet, so you can take that and things will get better. Now we talk about influenza. Influenza virus is sort of a bad virus, I will say, as compared to the flu virus, stomach flu virus. It is very common, and the season, again, this is the season starting now. The only prevention we have against the influenza virus is flu vaccination. And flu vaccination we started in October, and by now in our community, almost everybody who was willing to get the vaccination is already vaccinated. But unfortunately, the vaccination do not take effect immediately. It causes reaction in the bodies that produces antibodies against the viruses, and it takes about 1 month. So if you had flu vaccine 1 month ago, probably you are immune. Again, are you 100% immune? No. Because again, this virus, influenza virus or flu virus, has different varieties, and CDC and FDA, advise that what type of viruses we need to include influenza virus again in vaccine. So most common viruses we suspect that it's going to be effective during this season, they make vaccine against that viruses. So against those viruses, this vaccine is effective, but the viruses which are not included in that sample can affect you. So you can have influenza also. But if you are vaccinated, the chances of having influenza is very little. Even if you get influenza, the symptoms will be less severe and will be easily treatable.
Good.
If you are not vaccinated, then sometime you can end up hospitalized, and sometimes people lose their life also. So if you have influenza, the symptoms are, as I mentioned, fever, sneezing, nasal congestion, sore throat, cough, tiredness, fatigue, body ache. Again, call the medical center and use the mask and try to avoid contact with other persons to avoid spreading to other people. And the doctor will evaluate you, and if you have vaccination, even then, and if you don't have vaccination, we have medications that can at least slow down your symptoms and help you recover fast.
Good, good. Wow. Well, these are serious things.
Yes.
They're not to be taken lightly, and I hope that everyone who could get a vaccine did. I know some people may not be able to take it, so I guess there's some alternative for them if a person absolutely can't take it for some reason.
Almost there is no reason not to take.
Okay.
If somebody has a belief that I don't have to take it, it's okay. So if you get sick, there are medications which we can give. We call Tamiflu.
Yes.
Those are antiviral medications, and those medications at least decrease the duration of the disease and decreases the intensity of the disease.
Yeah.
So we have some treatment available in the form of influenza.
Yes, yes. Okay. Well, we have about 30 seconds left. Is there anything else about the medical center you want to tell us today?
Well, when medical center is again growing fast, is available for your service, and I think there are a lot of changes. It's running very smoothly. Patients are giving us good advice and good information, and we try to implement whatever advice we get, and we try to cover up our deficiencies. And not only that we are available during hours, post hours doctors are available, and you can contact us. And the best thing to get benefit from the medical center is if you come and see the doctor, please follow his advice and take your medicines.
Or her advice.
Her advice. And one thing I will again say, whenever you go to the medical center, please take your medications with you. So
You mean the bottles?
Bottles.
Okay. I never have. I did it once when they were doing something about a year ago, but I never have done that.
There are all types of patients here. Some are extremely smart, some are less smart.
I see.
So they are forgetful. So if they bring those medications with them, we will be in a better situation to assess if they're taking their medicine.
If they're taking it regularly or whatever. Yeah.
Yes.
I could see that.
Yes.
That's true. Thank you, Doctor, very much for coming today.
Thank you.